Hello, it's Dr. Lewerenz at Longevity Health Institute, and of course, Lewerenz Medical Center. Hope this finds you well, and hopefully this actually enlightens you a bit more. So I saw something today that I want to make sure that I go through with you in detail. We might have touched upon it before, but it's so common, that's why I want to go with you today, and it's about something very key in hormonal balance. And somebody might not think of this, and often it's mistreated in regular traditional approaches in medicine because it's not looking at root causes and physiology about what hormones can do to a person, particularly a female. But I also want to cover one thing before that, because this will make a big difference, and we do it here all the time. We have proof of it. We have clinical evidence all the time. If you have and have been told that you have a low immune system or a low white blood count or that you're prone to like immune things, there can be things done. We can fix your bone marrow, we can detox you and get heavy metals out of you, and we can use IV and oral vitamin C and glutathione and some of these wonderful things fixing your gut that build your white count and your immunity. We see it here, do it all the time. So remember that as a side note, because that was a little bit frustrating today. I had a patient come in from her specialist and said, well, you'll never change that. And actually we have evidence today that we did change it and her immunity is much better. But anyway, a little side tip. All right, so I had a new patient today, and kind of a classic case here. I might look down here to my right here just to reflect a bit because of just to review a few things. But it's so common, we see it all the time, and it is about hormonal imbalance, but literally that can make you crazy or make you edgy or make you so extreme mood swings that you see a physician that ultimately then wants to put you on a anti-anxiety, antidepressant, a benzodiazepine, something like for anxiety to calm you because of these reactions. And technically they're really hormonal reactions, okay? And they're legitimate. And why is that? Well, because of what's going on in the imbalance in the ratios of these hormones. So let's review a few things. When a woman goes into perimenopause, and that is the earlier menopausal hormonal window or decline, they are mostly losing progesterone, not estrogen. Okay, and if that particular woman tends to be very physical, an athlete, works out a lot, lifts a lot of weights, does a lot of high intensity training, typically this is somebody that's going to be an athlete in their life, in their teens, 20s, even 30s. They exercise a lot. They love that. It feels good. They get adrenaline rush. They get do wonderful things with those wonderful hormones that are naturally happening in their body. But what happens as you get into your late 40s, like this lady, you're getting into a later perimenopause, which that progesterone is going to drop. Progesterone is calming, feel good, better libido, weight management, weight balance, better hair, and we call it a feel-good hormone, sleep good, etc. You start to deplete that in ratio and in balance with estrogen and testosterone, and all of a sudden you have somebody that's more estrogen and testosterone dominant, okay? And when you exercise, what do? Usually most of us with exercise, until you're much, much later in life, when you lift weights and you do high training, at that time you're releasing more testosterone, men and women. You can actually spike your testosterone about 10 to 30%, depending on studies, just from working out, just from exercise. Now, of course, that has other factors too involved, like high protein in your diet, high amino acids, and the type of exercise, but that can happen. So here we have a young female athlete, notoriously going to be higher testosterone, gets into her middle age, into her 40s, is training and working out, juggling stress in life and etc., but that's her stress relief, okay? But she's losing the balancing effect of progesterone. So what's going to happen? Well, scary stuff. I'm laughing and smiling, and she did with the visit today, but it's kind of scary stuff. Road rage, big fights with family, fights with her husband, panicky episodes, irritability, episodes in the month of not sleeping well at all. These are all testosterone dominant effects. Doesn't mean that we have to lower testosterone. It means we have to use a balanced hormonal approach with natural progesterone. Okay, now obviously she was new. I will see her back very soon and get her balanced. Everything we do is very personalized here at Longevity Health Institute, so we're getting some testing in saliva and in blood so that we dial her in perfect, okay? But the point here is that this very commonly can be overlooked. In her case, it was so bad with road rage and some family and friend outbursts that actually she was put on a medication for anxiety that now has helped her, she admitted, but it also numbed her. Her libido's gone down, she feels a little blah, she gained about 5 pounds, and so some of these deleterious effects that are not pleasant, but all that was a band-aid for the mood, emotional stuff versus treating the underlying hormonal imbalance, okay? So we always got to get and think of the root physiologic cause, okay, and get you dialed in. Now, when that happens, she's going to lose weight. She's going to get better hair, better libido. She's going to be able to get off her anxiety medication that she's been on for the last year. And she's going to be healthier. And why? Because progesterone is breast cancer protective. We take her out of the estrogen dominant window, which is a higher risk for breast and ovarian cancer. And so we're making her well, besides a better quality of life, and treating the underlying cause versus that Band-Aid effect that is not always the best. Now, I'm not opposed, and you've heard me say this, to anti-anxiety, antidepressant medications and prescriptions when they're needed and they're appropriate, and the other physiology and the other chemistries and hormones have been looked at so you get the best result, so that you're treating the cause and not just a band-aiding approach or a symptoms treatment, okay? So hopefully that made sense. I think that covered her very well. She's had a few other little things, gut related, that we're always going to work on, because we always work on gut health, and that's your immune system. And she had a little bit of bloating and a little bit of indigestion in that. Ironically too, maybe that's even playing a little bit of a role into her anxiety and irritability, because your gut is your second brain. The nutrients, the minerals, the amino acids you absorb in your gut help you make the brain chemistry. Help you make the neurotransmitters like serotonin and norepinephrine and that. So I'm sure when we get all our information back, we'll be able to put this together nicely for her and get her dialed in and get her very happy and get her goals resolved, which were weight loss, off the anxiety medication, better sleep, and a little bit better energy, and get to the root cause. So I hope that enlightens you about the balancing hormonal approach, but how testosterone, estrogen dominance, okay, they're not too high, it's not elevated, nothing's been given to her, but that a balancing approach with progesterone so that she's not estrogen and testosterone dominant, her mood is much, much better. She'll be back to herself. Nothing better than that. So anyway, this is Dr. Lewerenz, getting to the root cause and treating you with a personalized functional medical approach. We're here at Longevity Health Institute in Rochester Hills and in Madison Heights and soon to be Bloomfield. Me and my practitioners are happy always to help and bring you the best in personalized medicine. Have a good evening. Be well.